an irregular head, and you see these high signal areas surrounded by low signal rims, and vice versa, low signal surrounded by high signal rim. And that is the normal hip joint. Again, very black because we suppress the fat in it, and there's a lot of fluid there, and you see the irregularity. That was another case which was, they can be complete muscle tears, and later on there can be hematomas, and when the hematomas progress, they can get calcified or ossified, and you get what is known as myositis ossificans. Grade 1 and 2 muscle injuries, again, we were suspecting that this was a case of bilateral AVNs, which is very rare. We actually looked it up on MR. There were no abnormal signals, and this actually turned out to be Meyer's disease, which is actually epiphyseal dysplasia, predominantly affecting only the hip joints. I'm sorry I had to rush through all this, but there's so much more. Thank you very much.
Thank you, Dr. Shazi. It was very interesting and very fruitful. The next lecture is by Dr. Shahryar Nuruddin. He's an orthopedic surgeon working in Aga Khan University Hospital, Karachi. He'll talk about the advances in joint replacement therapy.
Assalamu alaikum. My name is Dr. Shahryar, and in this day and age, no one orthopedic surgeon practices the entire breadth of orthopedics. Today, there are about 12 formally declared subspecialties in orthopedic surgery, and I have the good fortune of pursuing 4 of them. I do pediatric orthopedics, I do joint replacement, I do arthroscopic surgery, and trauma is something all of us do. And this morning we'll spend the next few minutes talking about what are the recent advances in hip and knee replacements and how they have revolutionized the lives of patients with debilitating arthritis. To give you a few numbers, in the US about 230,000 total hip replacements are done per year, and about 475,000 knee replacements are done annually. And in the whole world, if you look at the numbers, it's about 1 million joint replacements a year, and it's been projected by the year 2030 about 3 to 4 million joint replacements will be done annually. Let's start with knee replacements. Now this slide tells us the components of a knee replacement. You can see the femoral component over here, the polyethylene tibial liner, and the tibial tray. And if the patellar articular surface is involved, then we also resurface that and use that patellar button. This is how a post-op knee X-ray looks after knee replacement. Now basically there are several kinds of implant designs, implant philosophies for knee replacements. Broadly speaking, they can either be posterior cruciate retaining or sacrificing. In the cruciate retaining, the advantage is that the gait is more resembling with the normal gait, but it is less constrained, and that means there is an element of subtle subluxation. Doesn't translate into clinical meaningful things, but when we study it with gait analyses, you see the difference at that stage. But the more commonly done is the cruciate sacrificing ligament, and that is stable based on the conformity of the bearing surfaces. Now if you look at the clinical results,